Interesting.
You know, this isn't a question, and I don't normally do this, but I'm going to read it because it goes back to a discussion we were just having a few minutes ago. This is a comment from a viewer from that famous Minnesota location, Unidentified Town.
Oh,
wow.
Well, we have a few of them.
John's district.
John's district. But anyway, so...
Maybe it's Melissa calling in.
Maybe, finally, because she heard we were going to text her. That's great.
It.
There you go. When the waiver programs began, we spent about an hour with the consumer and an hour on paperwork to set up services. Now social workers have to ask up to 800 questions and spend 6 to 10 hours setting up the same services.
MNChoices.
And then what follows is a rant on a well-designed rant thereafter about we maybe should think about redesigning that system.
And I would give you the exact same description and conversation we had about how we approach that technology. What they forgot to tell you is that because there's hundreds of workarounds. That's the MEP system that our poor county personnel have to use to do an intake. 8 to 10 hours. But if they just don't get it right, or they haven't covered the scenario in which they're implemented, or when they're boarding somebody on there, they get to start over. They get to delete it and start over. They missed that one.
Well, and the thing, this is the MNChoices system that's being changed to the waivered services were set up. And remember, under the Medicaid waiver, when you've seen one Medicaid plan in a state, you've seen one Medicaid plan in a state. Every state has its own way to respond to what the Medicaid, the 6 different criteria that states were supposed to do to define it. Minnesota has now set up this MNChoices, where it was supposed to be more user-friendly, family-centered, client-centered. Families have said it's taken 8 to 10 hours, them sitting there, and for whatever reason, how it was rolled out in a way that wasn't either any of them, and they've gotten away. They've gotten away from really that. You know, where's the interpersonal relationship happening here? And they've gone to the structure.
They don't know who their customer is, and so part of the corrective action to that is the decision makers in Department of Human Services need to be attached to their decisions.
Here's what his favorite thing. You know what he wants to do, and I actually agree with him on this one, Jeff. Everybody in the Department of Human Services must spend a year back in the field.
Not a year, no, but I want them on the front lines.
Couple months.
Whatever the front lines are. It's not a complex process. But put them in the front lines. Their staff are the front lines in DHS. But they have 2 different sets of customers beyond that. They have the Department of Human Services in each county who actually deliver the services.
They do a good job.
They do the front line. A small county like Chisago County, people wouldn't understand, has 126 Department of Human Services staff, county staff. And so DHS needs to work and actually do those intakes and to be attached and understand it. And then we need them out in the industry in which they serve. Nursing home. I want them working 1 week every 6 months. Well, we will not change our delivery mechanism of what is government.
And unfortunately, in the waivered services world, you've seen a lot of third parties come in. They're no longer DHS because less government. You know, your team likes less government.
Less
government.
You're right.
And so, come
on over, John.
We want functional government. You're closer to this. You're closer to this side than you are.
The unintended consequence was you saw less of the state level and more of it devolved out to the local community, and then the county saying, "Well, we really can't." So then they devolved that out to a third party. And then you have the department coming in saying, well, we're going to do this waiver reimagine. Have you guys been having that conversation at all? Waiver reimagine.
I like them reimagine.
It's actual coming where they're taking 4 different waivers and they're going to get them down to 2. And so it's a good idea because it solidifies really, because to be on a waiver is just a payment. I mean, you're saying what you're waiving is you're waiving your right to institutional care. So with that comes either a Katie Beckett waiver, a CADI waiver, a CAC waiver, whatever you have it. And so it's really, goes back to processes. And I'm glad you brought this thing up. Have we processed things through? Have we thought about how this is going to work? Did we talk to the people down in the trenches? And that's the main line. Did they go and talk to the folks that are working in their centers?
Answer's no.
Yeah, they don't. Well, it's just not. And it's just not nursing homes. I mean, look at
PCAs, the home health care.
But also
DT&Hs.
Daycare, huge, just a key. I mean, with the auditor's report that we saw, that there's fraud going on, and when you have that disconnect, if you're not the boots on the ground, then there's not that check and balance. And again, we have to come to that. What resources are we using? We're using the taxpayers' resources. And you know, I have a staff person I love her, but she'll call me and says, Jeff, can we do this? Can we do this? I said, well, if we do that, we got to find money someplace else. Can we take it out of your paycheck? No. Okay, you got the answer. You know, when people start to see that it's coming out of their paycheck, it's just like I was doing a radio interview and we're talking about OneCare, you know, the new OneCare and how it would hurt rural hospitals because it's based on Medicaid payments. Well, I was doing a radio announcement today. I said, well, Marshall, would you like to get 65 cents out of a dollar when you get your paycheck? No. Well, that's why rural hospitals will not work on OneCare, and we kill the individual market. So we got to look, people's got to get, like my father would say, people's got to get real. And get
People's got to get real.
Yeah, oh, my father says that.
Really?
It's just like my father does once. I did this last year. Put a bill on the House floor to eliminate sales tax from electricity because let's face it, electricity is essential. If our lights go out, it's like not having food and water. So hopefully he's watching because I got it mentioned tonight. So, but when I get home this weekend, he'll well, is it on the House floor?
John, would you have a promo you'd like?
Yeah, it would be good.
So
It's
what do you
essential.
two?
I like that.
So John, there you go. You got to carry it on the Senate side, okay?
I'm going to have to throw in broadband's essential.
Oh, yeah.